there are a lot of just AI generated things that young children, girls, boys are comparing themselves to, and it's just not real. And that's why I'm here. I'm a voice that's telling you, let's take off those filters.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Crystal Norton, who is a board-certified family nurse practitioner with 20 years of clinical experience and the visionary founder of Unfiltered Medical Spa. She's a nationally recognized provider recommended by the top 100 injectors of America and a sought-after educator committed to training students in how to blend the art and science of aesthetic medicine with a focus on the golden ratio to achieve natural-looking, results-driven outcomes. In addition to teaching, Crystal maintains a thriving medical spa practice serving her own clientele, where she consistently delivers treatments with harmony and precision to help clients remove the filters that hold them back and inspire lasting confidence. Her dedication to excellence has earned her recognition as a top 25 injector in Utah and a master injector by the Foundation for Medical or Aesthetic Medical Excellence, cementing her reputation as both a leading practitioner and educator in medical aesthetics. So Crystal, welcome and glad to have you here.
Thank you. I'm glad to be here.
Yes, let's dive right into it. Crystal, how did you first get interested in medicine?
I have in medicine in general. So in medicine in general, I have a brother who has osteogenesis imperfecta or brittle bone disease. And I spent a lot of my childhood helping to care for him and seeing a lot of nurses and doctors care for him. And that really sparked my interest. I was always had a keen ear to what they were saying and very curious about it. So that kind of led me to medicine.
Got it. And then how did you make that jump from medicine into aesthetics specifically?
That was a very interesting jump. It wasn't intentional at all. I was a young nurse working on an oncology floor, and I had a patient who had prostate resection, was in a lot of pain. We got his pain under control, and I handed him the call light and said, "Give me a call when it gets 3 or 4. We don't want to let it get out of control again." Well, he never called. When I finally went in to check on him, he was in pain, shaking, and I asked, "What happened? How come you didn't use your call light?" And he looked at me and he said, "Well, I thought you were mad at me and I didn't want to make your night worse." And I was shocked. I'm like, "What?" I didn't even understand. I'm very glad that I asked him at the moment. I said, "What made you think that?" And he looked me dead in the eye and said, "Your face is crunchy right here." And he was not wrong. I had been spending hours charting at night on a little screen. So I had developed deep furrows here. The very next week, I went and got Botox. And then, just like when I was watching the nurses and doctors with my brothers, I was watching the nurses and the doctors who were giving me my injections, very curious about it. They fed my curiosity, and one thing led to another. I took a Botox class, and here we are years later with a thriving medical clinic.
Got it. Man, that's quite the story of how you made that transition. So now that you have your practice, what are some of the most common treatments, common services that your clients come to you for?
Well, the most common is always Botox. And when we say Botox, it's like saying Kleenex. Botox is a brand, but we mean all of the different varieties that are there. That is probably the number one thing that people come in for. It's where people get their toes wet, and we build from there.
Okay, so it's kind of like the gateway drug into aesthetics.
You're not wrong. Yes.
Okay, so then when it comes to Botox, let's say that somebody is thinking about doing this for the first time. They're probably going to start with Botox. And then if someone's looking at Botox, like what does Botox really do for them? Like they know that people that want to look younger, want to look better, they get Botox, but what exactly does it do for people?
I like to explain to people that our face is going to change over time no matter what. That's just the aging process. We are very fortunate to be able to choose how our face will change with time. Botox is a muscle relaxer. It's not a freezer. It's not a paralyzer. Those are misconceptions. Botox retrains muscles to stay in a more relaxed state so they don't fold and cause wrinkles in the face. When a paper bag folds over and over again, it creates a line in the bottom, even when it's outlaid. And then the face is no different. When we make expressions over and over again, it's going to create lines. When we can retrain the muscles to stay a little bit more relaxed, it will resolve those lines. They'll heal in and they will disappear.
Okay, got it. Yeah, because I've always heard of it being as more like it's supposed to freeze it, but it was never really explained as that, oh, it should be actually very relaxed. And now I can understand like why it's relaxed, like how it smooths out by being relaxed.
Yes, exactly.
Okay. So then if they start off with Botox and that's kind of the way they start getting into aesthetics, what is some common transitions of where they go after that?
That's very age dependent. We have a lot of younger people coming in for preventive Botox. And from preventive Botox, they will usually go into lips. The young people like lip filler and then also the skin services. They're coming in for the glow facials before their weddings or before certain events. Our mid to older population, they've lost a lot of volume in their face, and we really focus on biostimulators or things that will naturally help you rebuild your own tissue as far as it can go. Once we've done that, if you need a little polishing with filler, then it's a beautiful addition, just like frosting on the cake.
Okay. And you did bring up one topic that I wanted to dive a little bit deeper into was the preventative side of aesthetics. So do you feel like there's more and more of the younger generation coming in looking for preventative measures, or do you think it's a small group and it's really more the older generation that's looking more for these types of treatments?
No, the younger generation, they grew up with Kim Kardashian and and so they are used to this. This is normal for them. Just like going to the gym, you go to the gym and you're taking care of yourself so that when you're older, you'll have more mobility and you'll have a better life at the end. So they're applying that same principle to aesthetics. So they want to keep their youthfulness and their look well into their later years, and they're starting earlier, and they have no inhibitions about this.
Okay. So I guess that'd be a good thing, like they're taking those preventative steps. Do you feel like this is something that really a lot of people at a young age should really start thinking about early on? Because I know a lot of young people think, oh, I'm young, like body's very pliable, flexible, like you don't worry about this kind of stuff. But how important do you think it is to start looking at this at a younger age so you can prevent it long term?
I think this is a very tricky question. I don't like the word should because aesthetics is very, like, it's very individual. Some people will go through their entire life and not pay attention to aesthetics, and they're happy with that. And that is great. I would never want someone to feel bad for not doing something that they don't feel like is necessary. I personally wish I had started much younger. I wish I didn't have that experience in the hospital with that gentleman thinking I was mad at him and I wasn't, just because of the lines on my face from studying. So I can't say should, but it will prevent a lot of lines later on. So if you are concerned about appearance and aesthetics and that's important to you, starting younger is better.
Okay. And is there a certain age group that it's too young? Because I'm hearing things that like people, even like, or girls, like most like in like 12 or 13 or 14, which I think is really young. But maybe that is a good time for them at least to have that idea of preventative and looking forward to the future and figure out ways to kind of fix that now before it gets to be a problem.
Yeah, and I think that's where like home skincare comes into play and teaching them about sunscreen and the damage the sun can do. 80% of our aging on our face is related to UV rays. So just getting a 12-year-old to use sunscreen will go a long way. And that if they did nothing else besides that, they would be way ahead of the game of someone who isn't using sunscreen. It's kind of touchy when you're treating someone like with injectables under 18. I do treat people under 18 and it's a case by case basis. For example, I had a 14-year-old girl who was thinking of dropping out of school. She'd been ridiculed because of her nose, did not like her nose, was made fun of. We brought her in and did a liquid rhinoplasty, and her confidence boosted. She was able to stay in school. And so cases like that, I think it's okay to treat someone younger, but to give someone the idea when they're 12, 13, 14 that they have to do these things to be beautiful, I know that we shouldn't be doing that.
Yeah. I think you brought up a really good point when it comes to just that story that is very memorable. I think when people think about aesthetics, they look at it more through the lens of, oh, it's just about vanity, it's just about all about looks. But when I asked people to tell me like what's their most memorable stories of clients and patients, it's almost always someone that just felt a little bit deficient and they just wanted to feel like their best selves, or they just wanted to feel normal, or they just wanted to feel a little bit more confident. And I think that's the most important thing that people miss in the aesthetics industry. It's really about getting confidence. It's not about trying to maximize your beauty.
Absolutely. And we all have one little flaw that we don't like. And those little flaws can impact our relationships. They can impact our work. When I was younger, I had a gap between my teeth. And so when I would laugh or smile, I would cover my mouth. Think about the impact that would have on relationships if when I'm laughing, I'm always covering my mouth.
Mm-hmm.
Think about the psychology of that. So there are some things that if we have things about ourselves we're not comfortable with, it's in the back of our mind. We can't be fully present with the people around us. So it can impact relationships. It's not just about vanity. It's about that inner confidence and being able to be unfiltered and really present with the person in front of you instead of thinking about your insecurity of your chin that's small or your nose that droops.
Mm-hmm. Now, I'm curious about what your take is on social media. I mean, there's pros and cons, I think that most people can agree on. I mean, the pro side of it is that we kind of talked about like with the younger generations that they're taking these preventive measures and they really kind of learn that from social media, which I think largely is a good thing. But then there's also the unrealistic expectations, the flip side of that, where people are using filters and it's like they're setting the bar for this unrealistic level of beauty. And then many other people are trying to feel like that's normal. And if they're not that, then they're not normal. So, what's your thoughts on social media? Do you think it's been a net positive or a net negative?
Gosh, the verdict's still out on that, and you are not wrong. There are a lot of just AI generated things that young children, girls, boys are comparing themselves to, and it's just not real. And that's why I'm here. I'm a voice that's telling you, let's take off those filters. Let's connect one-on-one with another human without the mask, without hiding who we really are, because there is true beauty there. So, there is a lot of positive that comes with that. They can learn about things that maybe they aren't taught in the home. My mother never taught me about sunscreen. So, like, maybe I can be an influence and teach someone about sunscreen. There's also parameters. When you have an account like mine, we can't market to children. That's just, I mean, there are safeguards in there. I don't think there's enough safeguards in there, but there are some. So it becomes our responsibility as providers to make sure we're sending holistic messages that we're not creating more harm than good and creating self-esteem problems. We're fixing self-esteem problems, not creating them.
Mhm. And what do you think as far as I'm sure you've had the situation where people have come in, they come in with a photo from Instagram that you know it's not real or heavily filtered or doctored, and like I want to look just like this. How do you approach a situation like that? Like, what do you tell them? Like, how do you how do you deal with a situation like that?
That's a very good question. I will always start with that person's unique beauty. So when they look at their face, most of us look at our face or our body and we see what's wrong. We don't see what's our gift. So if someone's coming in and they want lips because they have thin lips that are small and they're bringing a picture of visibly doctored lips, I will talk to them first about their cheek structure, what beautiful cheek structure they have. And maybe could your lips be balanced a little bit with a strong cheek and a strong jaw? Yes. And then I will actually point out in the photos the things that are evidence that is showing that it is an AI generated or that it has been filtered or doctored. And it's pretty easy to detect those. I've been in this business long enough. You can see when it's happening, but not everyone can. So it's our job to educate and help them see that so that they can be better consumers.
I think that's a wonderful way that you approach it. It's not so much about telling them, hey, this is not real. It's more of highlighting to them first, this is what's beautiful about you. And then how can we attenuate that beauty? I think that's just a really, really great approach that you take to talking to these people that have these kind of unrealistic expectations of the beauty that they want to achieve. So, and with that said, I'm curious, like, what's your approach to how you educate your clients on these treatments, the benefits of the treatments, and really just the overall importance of education?
I think a lot of clients will come in and they have in their mind what they want. They have a picture and they think they know what it will take to get that picture. They'll come in and they'll say, I want to have these lines disappear here. So I want to have you put filler here. And that's not always the answer. Sometimes it's lifting the cheek that needs to happen. So I think my expertise, my education, all my years of doing this helps me to be able to guide them in their treatment to know what's going to get them to their outcome, regardless of what they're coming in for or what they think they're coming in for. It's my job to interpret that, take it into the skills and the products that I have, and let them know how I can best achieve their results. And you can't do that without educating them. You can't do that without letting them know what each tool can and cannot do. And I'm very forthright with what tools can't do. And I'm very forthright if someone's coming in and asking for a surgical result. I have plastic surgeons that I refer to and work with closely, and I will refer out. I never want to overpromise and underdeliver. I would rather overdeliver and underpromise.
Okay. So the educational part of it is really critical. And do you feel like your clients these days have a higher level of education about the treatments, about the benefits than some time ago? Or do you think that it's lower because there's so much information out there they just don't know what to trust? Like, what's your feel as far as like the level of education that your clients come to you about the treatments?
I think there's both. I think there's clients that have been in the business and they follow all of the accounts. They know how the treatments work, so they come in very highly educated. But I also think because this is more in the social media, we're getting clients coming in who are brand new to this industry, who don't know about anything in the industry. So I'm actually seeing a fair mix of both highly educated clients in the aesthetic business and how treatments work, and then people who have also coming in for the very first time and know nothing.
Okay. And within that vein, do you feel like a lot of the information and education out there is generally good? Or do you think that there's actually a good bit of misinformation that people are putting out there that it's just to kind of get them more followers or more attention, but it's just not the right way of doing it?
Yeah, absolutely. There's a lot of stuff out there that is sensationalized and it's clickbait and it's straight up misinformation. Um, Not in the United States, but outside of the United States, there is a tendency to have um, very unrealistic pictures posted of before and after. People are flying to other countries, getting treatments done. Some people are coming back with a great result. Some people are coming back with terrible results or terrible complications. So we're seeing a lot of misinformation out there. You do have to be savvy. You do want to be looking into your provider. If you're thinking of getting a treatment, don't just go off of one reel or one post. Look them up. Are they board certified? What is their background? How long have they been practicing? Um, a before and after is really easy to fake.
Okay. So along with those tips that you just provided, what would you say is the number one piece of advice you can give to someone who's looking at getting some type of treatment done, but isn't sure who to choose? Like, what are the main factor or factors that they really need to look at?
I think the best thing they can do is take a dose of patience. Don't rush into anything. If you follow someone on Instagram for a while, you will get the cues and know if it's genuine, if it's a real account, or if it's not. So that's the number one thing. Don't rush into anything. Take your time. Do the research and make sure you're seeing a safe provider who's board certified.
Great advice. Now, Krista, we did talk about some misconceptions as far as the treatments that you provide, and like when people come in, they maybe have the right idea, maybe they don't have the right idea. What are some of the most common myths or misconceptions you hear from clients coming in?
Yeah, the most common with someone coming in who's new is Botox. So Botox is a muscle relaxer. There's all kinds of information out there that says Botox can erase lines. It can, get rid of wrinkles. So we don't just have wrinkles up in the upper face where Botox shines. Some people also come in with wrinkles down here, and Botox isn't really good, for wrinkles, nasolabial folds, or maybe jowls. It really shines more in the upper face, the jawline, the neck. So I think that's one misconception that I see people coming in with is, hey, I want these folds disappeared because of Botox, and that's just not going to work. It'll mess up their smile and make them look like they had a stroke.
Oh, wow. Okay, that's really good to know then. Okay, so then I'm curious also, Krista, as far as creativity, artistry, what role do you believe that this plays in how you approach patient care?
Oh my goodness, this is so important. Owning my own clinic, this is not my first rodeo. I have been a medical director at several other, even chain med spas. And one thing that I do not like seeing is when there's a product or a treatment that's promoted and there's a big buy-in by the company. And so now they have this product that they need to sell. So everyone who comes in the door is going to be offered that product, regardless of if that's what their face needs or not. So I am a stickler about only recommending treatments that face needs, not like what's on sale this month kind of a thing. You're doing your clients a disservice if you're just putting something in there that's truly not going to enhance and balance and harmonize their face. So that's what I'm looking for. I'm always looking to harmonize a face, bring symmetry and balance to the proportions.
Okay, and with that, how, as far as if a consumer or a client is looking for a provider, should they try and look for someone that does have that artistic eye, versus someone that's just technically good?
I could go both.
Hard.
Yeah, some people really do have an artistic eye. It's coming from within. They really don't need a structure. But in education, there are things you can do to teach that artistic eye. There's measurements we can take. We can use calipers and measure the distance from, your brow to your forehead to your bottom of your nose, and bottom of your nose to your chin. That tells us information about where your face might be out of balance or out of harmony. There's a rule of fifths, there's a rule of thirds. There's so many mathematical equations that we can teach to someone about a face. So I wouldn't necessarily say you just have to have a good eye, but there are people out there that are just gifted with that.
Okay, that's very interesting to think about that because it's I think I find it hard to believe that anything like artistry can be taught, but I mean it sounds like that it can be done. It's just a matter of putting it into a structure where there's art in it, but also a structure that goes along with it. So I guess you're kind of combining the two.
Correct. And I
Okay.
think I think injecting is an art, but it's not like an art in the other, like with painting or with sculpting. It's very different. There's research that shows infants will spend more time looking at a face that is beautiful, that has more symmetry to it. So if we're talking about the symmetry and the art of creating harmony in someone's face, then that can be a mathematical equation. And every research study that shows what humans' eyes are attracted to, whether it's an infant or older people, it will always include symmetry. And this is across ethnicity everywhere. So if we can bring just more symmetry to a face, we will enhance the aesthetic. And that can be done with measurements.
Okay. So the golden ratio that I mentioned in your introduction, is that a big part that plays into it? And if so, also, what is the golden ratio?
Yeah. Yes, it is a big part of what we do. The golden ratio is what is found in nature. So if you have a snail shell, it's kind of circular and it goes out. So it goes out at a certain distance every time there's a circle. And that is a mathematical equation. These are what Da Vinci used in his art. And it's found all over in nature. And when we use that in art, the human eye is attracted to that, hands down, 100% of the time when we bring those ratios in. And there's research that shows this. If you put two faces together, the one that has more symmetry to it, and you need to pick which one is more beautiful, they will pick the one with more symmetry most of the time.
Okay. So I guess when people talk about things like facial balancing, is that really similar to trying to achieve that golden ratio and achieving that symmetry?
It is 100%. Yeah.
Got it. Okay, perfect. Now, Krista, I do want to dive a little bit into the training side of your business. Can you talk a little bit about that? Like, who's the training for, and what specifically do you teach?
So teach all of the injectables that I perform. So that's everything from Botox to PDO lifting threads and fat dissolving with Kybella. I've taught for a lot of years. I've taught for these big chain spas. Most of the education you will see out there is in group settings, small group settings where you have 5 or 6 people and you have a few models, and all of those 5 or 6 people are in the room all at one time. You might get to inject someone a few pokes here and there, but my experience after asking every single student when I was done with the lecture is, what could I improve? And hands down, every time they say, we need more hands-on practice. We need to do this more. Being in a group of 5 or 6 people and getting to poke a few times on one person is not enough for someone to then go out and be able to start this. So that's why I've developed only one-on-one education and a 3-month internship. This isn't just like a weekend class. This is an internship where you're going to go from novice and not knowing anything to being in the room for 3 days a week for 3 months. And that gives you a whole different kind of education than just a weekend class.
And I think that's really great way that it's structured because it is really about repetition. It's about the number of times that you go to bat and practice this. And I think having that additional training, that longer training really is helpful. So is this training going to be more for people who are brand new to the industry or people that are in the industry but are looking for like a higher level of skill or like a more advanced class, I can call it?
It's both. So I have beginners come in. The best place to start is with Botox. But then I also have injectors out there who've already been doing Botox and fillers, and now they're ready for more. They might want to dip into biostimulators or the PRF, the platelet-rich fibrin, where we're drawing blood and then re-injecting that back into the face, or even the lifting threads, the medical grade sutures that we lift tissue with.
Okay. And is your trainings in person or is it virtual or do you have both options?
So my trainings right now are in person. In November, I can't speak about everything for this, but I am about to release, there is new technology that we're taking advantage of that is going to change the way people learn how to do injectables. The most important thing is to get those reps, high quality reps, repeating a procedure over and over and over again till you're an expert. 10,000 hours is what it takes to go from novice to expert. And that's really hard to do if you're a beginner. No one really wants you to practice on their face and mess up. Do you know what I'm saying? So it's hard to get enough reps in there. But what we have in store is going to be a way that people can get those very high quality reps and get, 100 hours if they want in a very short time. So it's going to condense the time it takes to go from novice to expert in about half the time.
Wow, that's incredible. Really great. So then, okay, so Crystal, then I'm curious, where do you think the future of aesthetics is going?
Right now, I think we're going in a more natural route. 5 years ago, filler was the rage. We all just kind of filled hollow spaces up. Now we're looking into things more like, what can we do with your body to help it regenerate itself? We are doing peptides. We are doing biostimulators like drawing your own blood and injecting stem cells back in. We're doing PDGF, things that are more natural and that are going to give a longer lasting result and a more natural result.
Okay. And why do you think that the trend has shifted more to that natural look?
I think we really saw the overfilling. So people just saw how that pillow face looks, and or the alien, people can have, filler blindness where they just don't even see it. But we're starting to see just a shift overall going into the more natural side because of, the images that are plastered on social media showing the worst case scenario.
Okay. And are you also seeing kind of a bigger push into regenerative medicine, functional medicine, overall wellness coming into the aesthetic space also?
Yeah, 100%. So there's a peptide called the Glow peptide right now, and it's got copper in it, BPC 157 and TB 500. And it is a way to help your skin just glow and rejuvenate itself. It's an injectable that you do a couple times a week. And so you're creating this wellness and this youthfulness from within instead of just coming from the outside. I always like to say if you can work from within and out in, you're going to get a better result than doing either of those independently.
Okay. And do you think that those treatment methods is going to play a larger and larger role within aesthetics in the near future?
Yes, 100%. We're seeing a rise right now on peptides. I'll get multiple requests, new requests, people coming in for peptides right now, more than any other service in my clinic. So new people coming in, what they're coming in for is peptides more than anything else. Everyone's fascinated with regenerative medicine and
Yeah.
optimizing, right? We all want to optimize our health.
Yeah, I mean, I think there's kind of this big push of people looking for ways to look younger, but doing it kind of more from inside out, or like being taking responsibility for their own health, and maybe looking outside of the traditional hospital system to providers, to experts who know this stuff and can help them solve it from the inside, so it's reflected on the outside of it. So I think it's a really good push. I think it's a really bright future as well when it comes to aesthetics and all these other treatments. Now, with your practice in particular, Chris, I'm curious, what is your vision for Unfiltered Medical Spa?
My vision for Unfiltered is to end up opening more locations. So I have providers that are traveling a long way to get here, and it would be good for them to be able to have locations in surrounding states where they can service people there. Unfiltered, a big part of what Unfiltered is we are a laboratory for new injectors and for advanced injectors to come in and get the skills that they need. We are a bustling clinic, so we have a lot of patients coming in the door. So if a new injector has taken a course and just hasn't been able to practice or see it over and over, if they come into that internship, that's where they're going to get those reps and see that over and over again. So yes, we provide all those cosmetic services for our clients, but we're also a laboratory for education for people wanting to learn in this business.
Got it. Okay. Now, Crystal, I have one last question for you, but before I ask it, I do want to point people to your website at unfilteredmedicalspa.com. Now, last question is, what does beauty mean to you?
Hmm. Beauty to me is definitely coming from inside. It's not anything that I can do on the outside. I say that half of what I do in the chair for someone is psychology, and the other half is actually what I do. And that psychology is helping someone to see their face in a little bit different way. Like I mentioned earlier, we're all hypercritical of ourselves. We're only seeing our flaws. But if you can stop for a minute and talk to someone who sees faces all day long, and they can point out and say, look at this cheek structure, see how beautiful that is. That doesn't need anything to be changed. So doing things like that is helping to build someone's confidence and helping them take the focus off of the little flaw and see the whole picture. And to me, that's the psychology that I'm doing in the chair, not just, the injection that I'm doing.
Got
So
it.
that's beauty to me is as helping someone see their face in a little bit different way, and appreciate the things that are naturally there and uniquely them.
Beautifully said. Well, there you have it. Crystal sharing her expertise. So, Crystal, where can people contact you in your practice?
You can go to unfilteredmedicalspa.com, or you can call us at 801-885-6814. You can follow us on Instagram or Facebook at Unfiltered Medical Spa.
Awesome. Well, Crystal, it's a pleasure. Thank you for being here, and thank you for sharing your expertise and your knowledge.
You are welcome. It's been my pleasure.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.